Hi, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined by pandemic expert Dr. Carlos Del Rio, Executive Associate Dean of Emory University School of Medicine at Grady Health System and Professor of Medicine, Global Health, and Epidemiology. Welcome, Dr. Del Rio. It's good to see you again.
Good to see you, Jay.
We always let people know that we're going to have our weekly Facebook Live with you, and the questions stream in ahead of time, so we'll begin with those. And then in the meantime, we encourage people watching to submit their own questions, and we'll get to just as many as we can today.
Let's just start by, doing a recap a little bit about what's happened, because, we're doing this every week, and I'm beginning to think that, okay, so what's new in the past week? Yeah. And I think a couple of things that happened in the past week, the total count for the world surpassed 3 million. The total count of cases in the U.S. surpassed 1 million. We now have over 60,000 deaths in the U.S. That is more than the deaths of the entire Vietnam War. We have a few studies, one done in Stanford, one done in L.A., one done in New York, serological studies in which they find that probably the number of people infected is about 10 times the number of people that we know. So maybe there's not 1 million people infected in the US, but maybe 10 million people infected in the US. And a lot of those people were either asymptomatic or mildly symptomatic. So we're beginning to understand better the extent of the epidemic, how many people are infected out there. That obviously will have an impact in what we call the mortality, because right now we're seeing the mortality of about, 6-7%. When the reality is the mortality may be a lot lower once you consider that it's 10 times more people out there infected. But it also shows you how difficult it is to control this disease. And then finally, yesterday, there was a release of some positive findings on a new drug study with a drug called remdesivir. So all that pretty much summarizes the news that happened this week.
Yes, very well put. I think that a lot of the questions that have come in today match directly with what you were talking about. One of the things that people were asking about is, are the models wrong? Why the number of 60,000? Some people said, a model showed that wasn't happening until August. So can we trust these models?
Well, there's a saying that all models are wrong. Some are useful. I mean, models are models, right? And they depend on the input that you put in them. And I think all you can say from the models is it allows you to get an idea of what's going on, but they're not perfect. No model is perfect. And, we've seen all sorts of things, and I've seen, and there's wide intervals in, for example, the prediction of how many deaths. I think it's going to be anywhere between closer to 100,000 deaths. But that's what the White House, in fact, said in one of their press conferences, and then it has slowly been ratcheted down. But obviously, we're already over 60,000. So I think it may be actually more than 100,000. We really don't know. We're nowhere close to seeing a decrease in the number of deaths and decrease in the number of cases. So we have a ways to go. And I think, again, I remind people, look at the models, but they're not the Bible. Don't pay a lot of attention to them.
Good advice. All right, so let's get started with all these questions folks have for you. How long will it take before we know the impact of lifting the shelter in place in Georgia?
It's going to take a little bit, because whatever has happened up to now is what we're seeing right now. What new decisions we make today is going to take about 10 to 14 days before we see the full impact. So, brace, stay tuned, and we'll see what happens. We can talk in a couple of weeks.
Do you expect to see a spike in new cases with the relaxation of social distancing?
It's all going to depend on what people do. I think as individuals, as citizens, as business owners, it's all going to depend. I've talked to a lot of people who say, I'm keeping my business closed, I'm keeping my restaurants closed. I've talked to a lot of people, gyms may be open, but I'm sure not going to the gym. And I've talked to a lot of people saying, I'm not doing that. So again, I continue to suggest that people go out as little as possible, use a mask, wash their hands, practice social distancing. So the more people do that, the less the spike will occur.
Have you been satisfied with the CDC's response and communication with the public during the pandemic?
I have a lot of friends at CDC. I have a lot of respect for CDC. They're incredible people working at CDC. I've been a bit mystified and almost depressed about seeing the lack of public view and leadership from the CDC that I'm accustomed to see in other epidemics. I remember in the and the H1N1 pandemic in 2009. Dr. Rich Besser literally was in the news all the time. He was guiding us. He was a refreshing and a calming voice at that time, and he did that masterfully. In fact, that's why he later went on to be the medical correspondent for ABC News. I wish we had much more visibility of the CDC. There are incredible people there that could be doing that. Why that's not happening, it's way above my pay grade. But for those of us that live in Atlanta, the CDC is very close to our hearts, and I'm disheartened not to see CDC playing a bigger role.
Should Governor Kemp lift the shelter in place?
Short answer, no. Too early.
Well, word is that he'll probably be speaking sometime soon, maybe as soon as today, about it. Have you been able to have any conversations and advise him and give advice, your best advice on the direction the state should be taking?
No, I think I've made my opinions known, and I think he has his own team of advisors, and I think he's got Dr. Kathleen Toomey and his public health people that are talking to him, and I think, he's trying to do the best. Again, I emphasize that there's this seeming tension between public health and economy, right? But we need to remind ourselves that this is a public health crisis. Yeah. And we need, in order to rescue the economy, in order to save the economy, we also need healthy people. And we cannot forget that. So there really is there's tension, but there's not opposition. And whenever you talk about things like that throughout history, from a public health standpoint, it's always too soon to do things. From a business standpoint, it's always too late.
Mm-hmm. This next question is one that I could have given you because you and I have talked about this consistently. You've said several times to us that we needed to erase April. So this person's question is, you said to erase April. Is May next?
It may be. Depends on what happens. Depends on the way the virus is going. It may not be the entire month of May. It may be at least a couple of weeks in May. It may be that we need to continue practicing social distancing for more than May. I don't think that, we may not need, I don't know how long this is going to be, but I'm sure that we're not at the end of this yet, and we have a long ways to go yet.
Can you ask if ambient temperature is making a difference in the geographic differences in outbreak numbers? Seems population density and mean temperatures are also a key contributor.
I think population density is a key contributor, and that's why we saw what we saw, I think, in New York City, where if you've been to New York, it's very hard. You're in a population density condition almost every day, right? It's hard to get on the subway in New York and not be surrounded with a lot of people. It's hard to walk in the street and not be surrounded by a lot of people. The temperature issue, I think we still have to see. We still need to see really what happens. You would like to see the temperature play a role, but I caution you that in places that has been pretty hot, like Australia, they've had significant outbreaks. So I'm not sure that's going to make a huge difference, but I think we all want to see some change due to the weather. The problem is if we're doing social distancing and doing all this public health intervention as the temperature warms up, which was first, right? Which is really the cause is going to be really hard to determine.
Mm-hmm. If you've been careful and social distancing and your grown children and family are social distancing, can families start to see each other for gatherings in-house?
Yes, I think so, but assuming that nobody else is infected, right? But even if I was talking to a friend of mine the other day who says she has a big deck and she's having with some neighbors what she calls social distancing get-togethers, in which people can come for dinner, but we can sit 6 feet apart from each other, and we can still have physical distance, but not social distance. And I increasingly am using the term physical distance because we need physical distance, but we shouldn't be necessarily socially distancing from others. So I think figuring out ways to adapt how to do social interactions in this physical distant environment is a good thing to do. And I think what this person is suggesting is probably fine.
Great. Any special advice for pregnant women right now?
So I'll tell you that I have a daughter who's pregnant, and I have a daughter-in-law who's pregnant. So I hear about this on a regular basis.
Wow.
I have to be giving advice on a regular basis.
Yes, you do.
And my advice is that, you should not get infected, whether you're pregnant or not. I think so far we don't know about any side effects in pregnancy, except that, if you have a high fever, that could be a problem because you can have premature labor. But my advice is that you don't get infected whether you're pregnant or not.
Okay. With schools out soon, do you think summer camps and sleepaway camps will start happening in June?
I am not sure, and I'm not sure how you would necessarily do them, but you could. I mean, you could potentially say, we're going to test everybody that goes to the camp, including the counselors and the children, and everybody is negative. We're going to put them on a bus, and we're going to take them up to the camp, and we're going to have them in shelter. It's a shelter in place at the camp for 2 weeks in which they're all going to be with each other, and nobody else is going to come from the outside. That would probably be okay, but I want to see that being implemented is going to be logistically a challenge.
Kind of similar question. Can he share his opinion on when he sees it safe to return to youth sports as well as camps? According to the plan outlined by the president, these are phase 2 activities.
I think they are.
Sports camps.
I think there's a ways to go before we can have team sports and sports like that. Could you be maybe playing tennis with somebody? Maybe tennis is okay. It's a social distance sport. You're on the other side of the net with your opponent, and as long as after the match you don't get close to each other, you probably can play tennis.
Right. What is the status of outbreaks in nursing homes and assisted living facilities?
So right now, throughout the country, we have 3 that I would call hotspots. And the hotspots are jails and correctional institutions, meat-packing facilities, including the chicken packing and chicken processing plants here in North Georgia, and finally nursing homes or facilities for the elderly. And we're seeing throughout the U.S. significant outbreaks in nursing homes and significant mortality once the virus gets into nursing homes. So I think that's one of the areas that we need more aggressive action. And what I mean by that is we need testing, aggressive testing. We need to make sure that the employees don't come in and out. What I mean by that is frequently employees in nursing homes and these facilities don't make enough money, so they have to have 2 or 3 other jobs, and therefore they're getting exposed. And I think we really need to emphasize masking and hand washing and treat them just like we do hospitals, in which we really want to be careful because the risk of infection is very, very high.
I'm going to put together a couple questions now from different folks, but on the same topic. I'm a COVID survivor. However, going through severe post-viral syndrome, are there any medicines to help in any way on it? Another question, should we be concerned if we're still sick after 8 weeks? Can you talk about both of those?
So we have heard more and more of people that recovered from COVID, but they continue to have either prolonged shedding of virus, or they continue to have subsequent effects. They're simply not totally recovered physically. And we don't know what to tell those persons other than, patience and exercise and sleep well and pay attention to your body, because there really isn't anything specifically we can give you.
Yeah. What can we do to encourage runners to give way and run a wide path around older people when the sidewalks and streets are being shared? The runners, predominantly males, behave as though they must run in a straight path, even if it brings them within a few feet of the people moving slower. How can we convince them to swing a wide path?
Well, I think it's just a matter of convincing people. I think we all, this epidemic has shown us something, and I think hopefully we'll start applying that. It's not about us, it's about others, right? We need to really protect each other. We really need to really be respectful and be careful about each other. And that's the only way we're going to make it. And therefore, we need to be less thinking about us and more thinking about others.
Would love to hear his thoughts regarding how and why Georgia changed the way we report cases. Why is our state not being transparent with the statistics in regards to number of new cases each day and number of deaths? The website has been completely revamped. I don't know if that's something you can speak to, Dr. W.
I don't think I can really speak to, because I don't know how the reporting is done. I would encourage them to communicate directly with the Department of Public Health, because they really are the ones that are doing that.
Now that the FDA is approving remdesivir, how big of a difference will it make? Is it a game changer?
Okay, let's start by saying that, first of all, we don't know if the FDA is approving remdesivir or not. The data so far with remdesivir that has been out there is as a mixed bag. And the data that we saw encouraging yesterday is a preliminary look at data safety monitoring board from some of the data in the study. It's not even the entire study. So I look at it like thinking that you crack the door open. You're beginning to open the door, but you're not way there. So based on the data presented, I'm not sure how would the FDA ever approve the medicine. Now, you can use the medicine today in what is called compassionate use, and we are continuing trials with the medication to try to understand better what the impact is. But I seriously doubt the FDA is going to approve the medication. I may be proven wrong. What the medication has shown us, if the results hold, is that it can decrease the time that you are sick, that you require oxygen, by about 4 days. That's the impact. In other words, it may cut the length of hospitalization and the time you require oxygen, but it's not a game changer. This is not the cure. This is not something that we say, okay, we're done because now we have a pill we can take and we're fine.
So in your neighbor deck model, multiple people getting together even outside, but if you do that with multiple different people, even with some distance, aren't you exposing yourself?
Well, again, I think you could be exposing yourself, but if you have a limited number of people and you do a real social distancing, let's say if two couples get together, that's 4 people, and you're social distance, you probably are okay. Again, nothing is going to be perfect. I mean,
Right.
Nothing is going to be perfect, but using common sense may help.
There's a lot in the news recently about the rush for a vaccine, especially from Pfizer and the University of Oxford. Do you think we'll have a vaccine by the end of the year or earlier?
We may have, by the end of the year, a vaccine that seems to be effective, but that doesn't mean we will have a vaccine available. Once a vaccine has been blessed as approved, as useful by the FDA and other regulatory bodies, you have to produce millions and millions and millions of doses, and that's going to take some time.
Will individuals with COVID be able to even test for COVID since their antibodies and IgG and IgM are severely low like mine? Is full self-isolation still recommended for those with autoimmune disorders?
If you can still be tested depending what your immunoglobulin disorder is. If you have zero immunoglobulin, this is not going to. You're not going to produce antibodies, but you're very high risk of infection. But people with autoimmune disorders ought to be able to be tested and find. And we don't know the impact of autoimmunity in this disease, and that's a very good question, actually.
I'm hearing many oppose mask wearing and even social distancing in my state. It's no care for the other person. Also, many are talking about joining the herd immunity by exposure, like Sweden. Your thoughts on both?
Well, again, the idea of getting exposed and getting infected and getting it over with, I think it's a bad idea just because, you can still die and you can still get very sick, and you're taking a big gamble, right? I'm gonna jump into the ocean with some sharks and hope that I'm gonna make it across. Not everybody's gonna be bitten by the shark, but some will, and you just have to. And if you're older and if you are, but we just saw recently, CDC published data from here in Georgia. They looked at 300 and so individuals hospitalized here in Georgia. A quarter of those individuals had none of the risk factors that we typically think about. The median age was like in the 60s. So, you could still end up in the hospital if you get infected, and you can still die, and you can still have complications. So I don't think that's a good approach. And, as far as not practicing social distancing, I hear that. I'm concerned that again, this is a virus that is causing significant mortality. I don't want people to walk out saying, oh, this is no big deal. I mean, the excess mortality we have seen across the country, there's a big article on the front page of the New York Times today showing the graphs of the excess mortality across the country, is just incredible. I mean, the number of people that have died above what normally would have been expected to die in the last several months is just staggering, and something that, to me, it really gives me pause.
What standards have to be met before college students can return to school?
I'm sorry, I missed the beginning of the question. It got frozen.
What standards have to be met before college students can return to school?
Well, we don't know yet. We're talking at many colleges, including here at Emory. What exactly do we need to do? And we're still having conversations. I think we all would like to see college students come back in the fall. We're not necessarily sure how to do that and how to do it safely, right? But you may have, you may say, well, we want to serologically test students and see how many are infected. You certainly have to have testing available. You may have to change classes. Instead of having some classes that are, 80 to 100 students, you may have classes of 15 to 20, and you have multiple sections of that class. You may have to continue doing a lot through distance learning. I really don't know what the different things are. It's going to be nuisance, and it's going to be different.
When restaurants open, do we need to be concerned about metal dinnerware?
I don't think so. I think I would wash my hands well, and I would, wash my hands before and after I eat, but I do that all the time. So I don't see that as being a major change from what we do before. We need to have more concern about where you sit and how much distance there is between you and the other person.
Mm-hmm. When can we have weddings again? Seems most states are rushing to open.
So I saw the other day there was a wedding on Zoom. So you can have weddings now. You don't need to wait. You can have them on Zoom.
Okay. I do know a lot of people who had April weddings that are rescheduled to August, and I hope they can have them then.
I think we all would like to see that. The other day, somebody asked me, when can I have a wedding with 600 or 700 people? And I said, I don't know. And they said, well, how about if we do it, 100 people? I said, well, again, depends. If you're going to put 100 people in a space you normally were going to have 600 people, I think you can have them pretty socially distanced, right? And you could potentially do it. But again, it's not going to be simple. It's not going to be easy. And maybe some people are going to start using some pretty fancy face masks to go together with their talks. You're going to have your black tie face mask.
So yeah, that's a good idea. So do you recommend face mask for everyone, whether they're at a wedding, whether they're in a grocery store? Is it the personally responsible thing to do to protect others from you? Because I feel like there's still some misunderstanding about that.
I personally think that it's appropriate to use a face mask, and you're putting a face mask to prevent others from getting infected. But we all wear face masks. The studies that have been done suggest that if everybody uses a face mask all the time, we can decrease transmission by 10 to 15%. That to me is not trivial.
Yeah. What is your professional opinion on the 2 emergency room doctors in California who are questioning the test results of COVID-19?
That they're wrong.
Yeah. When do you think Emory will resume clinical for students? Is that the same as the rest of Emory and the rest of colleges?
I think they're talking about the medical students going back to clinical activities, probably clinical learning for medical students. That's probably going to happen, probably in June. That's what we're targeting.
Situation. An elderly couple in Atlanta, husband has Parkinson's and his condition has deteriorated to the point that his wife needs help caring for him. How to balance the infection risk from outside people coming in versus his quality of life now?
I think that's a huge question that we all have. And again, it's really difficult to answer, but the reality is you have to do what's best, right? And you need to suggest that people coming from the outside, wear a face mask and wash your hands and be careful. But there's going to be a risk. But it's a risk that I think you have to take because you cannot leave this person not having the support they need, right?
Right.
And I see, and I personally understand that because I have a similar situation with my mother. So I understand it fully. And you try to minimize the risk, but it's not going to be zero.
Yeah. For a company that returns to its office from working remotely, would you recommend all persons wear a mask inside or only when not able to physically distance by 6 feet?
Only when not able to physically distance, but if you're going to be outside, in other words, you're going to be in the hallways or you're going to be close to others, it may be worth everybody wearing a mask. I don't think it's such a big deal to wear a mask and just be careful. And probably you do both.
Why? Yeah. why are we testing with the current testing instead of antibody testing, which would give us a true idea of percent infected?
Well, it depends. One, the antibody test is to know who has had the infection. It tells you a little about who's currently infected. The test we do to currently infected is a test that is measuring the amount of viral RNA present in that secretions, and usually the nasal secretions. So those are two different tests. One is a test looking at the virus and looking at currently infected and therefore currently infectious, and the other test is looking at the antibodies present in response to the infection. They're two different tests.
A face scenario, are all face masks recommended or a certain number of layers? You and I have discussed this before. Maybe a quick refresher for folks is basically, I think, asking is anything okay that covers your face?
Yeah, you can use almost anything that covers, but you got to be careful that it covers for sure your nose and your mouth. And I think a cloth mask is okay. It's something that you can wear and will prevent, again, the idea. But if you wear a cloth mask, make sure you wash it frequently because, again, your respiratory secretions are going to be in the inside of the mask. So you need to be sure that you wash it regularly. Have maybe 2 or 3 of those so you can use one every day, and then we'll be washing them. But the reality is that a face mask that made out of cloth is probably good enough for what you want to do. Now, is that what I would use in the hospital? No, because when I'm dealing with patients, a different story.
I'm going to make this our final question. When do you think it'll be like New York City, and add to that in a city like Atlanta?
Can you repeat that? It got frozen. Can you repeat?
Sure. Yeah, no worries. When do you think it will be safe to work and live in a dense city like New York City? And I wanted to throw in Atlanta for you too.
Yeah, we need to look at the data. I think it's going to take some time. I think in New York, we're learning a lot from New York, and I think Governor Cuomo is doing a great job sort of looking at what we need to do and how to reopen. I think we're going to learn a lot by how New York does it. It's never going to be entirely safe, and I think we're going to have to understand what New York does, and it may be in phases that they go back to work. And, when does the subway operate again? And when does, there's so many questions there. The reality is that I don't think is going to be until a couple months from now before that happens.
And what about it?
In Atlanta, the same thing. I think we are a little bit less sort of a congested city compared to New York. But if you look at Midtown, you could be almost looking at a section of New York when you look at Midtown. I think we're going to have to learn different ways of working in offices, whether it's, half the people come one week and half the people come other week. I think we're all learning. I think a lot of things are going to change. We're going to continue having a lot of meetings through Zoom and other, video conferencing, because a lot of the things that we got together for are probably unnecessary, and we're going to have to decrease that amount of time we do. But the reality is, I think slowly but surely we're going to learn what's a good idea and what's not a good idea. I mean, I would tell people, and I remind this to people, there's no blueprint about what to do. It's not like we have a book we can pull out and say, this is what we need to do. Everybody is coming up with different plans based on what we know and what we think is going to be necessary, but nobody knows that this is the right playbook to use.
Right. The last question I have for you is, we kind of end these with some picture. If Governor Kemp lifts shelter in place, is your as a pandemic Georgian place being lifted? If that does indeed happen.
My advice are two things. Number one, continue practicing social distancing. It's up to us as individuals. Continue practicing social distancing, continue wearing a face mask, washing your hands. Let's be very careful and protective of our elderly population, because they are the people most at risk of dying from this disease. Nobody wants to get infected, but I really don't want to see older people getting infected because their mortality in them is pretty high. And let's be sure that we we continue caring for each other, and we continue thinking about this as something that is not just about me, but it's really about others in my community, and how do I prevent infection from reaching my community. And there's things that I can do to do that by not getting infected myself and by preventing others from getting infected. And finally, let's end by having some hope that with the results from the remdesivir study, with knowing that here at Emory we're involved in the vaccine studies, that science is the road to getting out of this problem. And that through outstanding science and research, we're going to make the discoveries of the medications and the vaccines necessary to solve this problem. So let's say yay for science. Let's continue supporting science. And let's say thank God for research, because research is really the road to recovery.
I love that as an ending, but I can't help myself. I have to throw one more at you. How can we not be so divided on this? So many people are so divided on this. How can we not be divided? Because it does pit us against one another. Those who think opening is wonderful, those who think it's terrible. And I know that's a really tough question to throw at you, but I just did.
Well, so I think we need to be able to understand each other. We need to be able to understand the concerns that others have. I've been doing a lot of listening, of hearing people talk about, businesses and their financial situation. And I think we need to think about, a lot of our pandemic preparedness plans did not think about the financial component very carefully. And I think we're learning a lot about how, saving business, especially small businesses, is a critical component. I worry about people not having enough money to pay the rent, to eat. I want people to have a job, but I also want people to be safe and to be alive. And what I would ask is that whatever your opinion is, let's not be irresponsible. Let's try to be responsible as much as we can. And let's not do things that will increase the risk, because we will all regret it. And we will all be, this is a serious virus. This is a serious epidemic. And not taking it seriously is what bothers me the most.
We'll end it there. Dr. Del Rio, as always, your Facebook Lives are a highlight of the week, and for many people bring much needed information and answers to questions that they've really wanted to know. So thank you for your time, because I know that you are, I don't know when you're sleeping, but I guess you're sleeping at some point in the day in a 24-hour period.
Well, thank you, and I look forward to seeing you next week.
See you next week. Be
Bye-bye.
well, take care. All right, bye-bye. See you later, everyone.